नमस्कार। नमस्कार आदरणीय अतिथिगण, विद्वान आयुर्वेदा आचार्य एवं देश भर से जुड़े हुए सभी आयुर्वेद विद्यार्थी साथियों, आप सभी का हार्दिक स्वागत एवं अभिनंदन है। आज के इस ज्ञानमय अवसर पर आयुर्वेदा अभ्यासनम राष्ट्रीय स्तर की ऑनलाइन व्याख्यान में आप सभी का स्वागत करते हुए मुझे अत्यंत प्रशंसा हो रही है। मैं डॉक्टर अविनाश लबाना, आज के इस कार्यक्रम का संयोजक एवं सूत्र संचालक आप सभी का स्वागत करता हूँ। यह व्याख्यान माला आरोग्य भारती पश्चिम पश्चिम महाराष्ट्र द्वारा आयोजित की जा रही है, जिसके अंतर्गत राष्ट्रीय स्वास्थ्य चिंतन आयाम के माध्यम से देश भर के आयुर्वेद विद्यार्थियों के लिए ज्ञानवर्धक का यह एक सराहनीय प्रयास है। इस आयोजन में भगीरथी मेडिकल फाउंडेशन का भी महत्वपूर्ण सहयोग प्राप्त है। सब कार्यों की शुरुआत में हम भगवान श्री धन्वंतरी जी का स्मरण करते हैं, तो हम आज भी भगवान श्री धन्वंतरी जी के स्तुति से शुरुआत करेंगे। हेलो।
यस सर।
ठीक है। ओम नमामि धन्वन्तरिमादिदेवम् सुरासुरेवन्दितपादपद्मम् लोके जरारुकभयमृत्युनाशम् दातारमीशं विविधौषधीनाम् चव्योमवातवनिवारिवह्निम् पञ्च प्रपञ्चात्मकदेहभाजम् सन्तापसम्पातजराज्वरान्तकम् नमामि धन्वन्तरिमादिदेवम्। नवीननीलं मुदकान्तिकान्तं शान्तं शान्तं हरिद्वादशमाख्यमूर्तिम् पूर्तिं सतनां सुमनोरथानां नमामि धन्वन्तरिमादिदेवम्। जय श्री धन्वंतरी। अब मैं उद्घाटक जी के परिचय के लिए आमंत्रित करना चाहूंगा डॉक्टर मनोज चौधरी जी का। आप अष्टांग आयुर्वेद महाविद्यालय पुणे में सह प्राध्यापक एवं विभागाध्यक्ष हैं। साथ ही आप आरोग्य भारती पश्चिम महाराष्ट्र प्रांत के भारतीय स्वास्थ्य चिंतन आयाम के प्रमुख भी हैं। हेलो सर।
हाँ, नमस्कार। मेरी आवाज आ रही है?
यस
यस
सर।
सर।
आज के हमारे इस सत्र के उद्घाटक है आदरणीय वैद्य श्री संतोष रमाकांत जी गठने। वैद्य संतोष जी एक अनुभवी आयुर्वेद चिकित्सक है जो वर्ष 2000 से पुणे के दत्तवाड़ी स्थित अपने धौम्य क्लिनिक में शुद्ध आयुर्वेद पद्धति से उपचार प्रदान कर रहे हैं। उन्होंने अपने पुणे विद्यापीठ से आयुर्वेदाचार्य उपाधि प्राप्त की है। खास करके कैंसर, किडनी, महामारी प्रबंधन और स्पेशलिटी उनकी वेलनेस काउंसलिंग है। ऐसे क्षेत्रों में वो असंख्य रोगियों को अपनी स्वास्थ्य चिकित्सा का अनुभव करा रहे हैं। वैद्य संतोष जी आरोग्य भारती के पश्चिम महाराष्ट्र प्रांत के सचिव तथा भारतीय किसान संघ के प्रांत मंत्री के रूप में सक्रिय भूमिका निभा रहे हैं। आप महाराष्ट्र आरोग्य विज्ञान विद्यापीठ के सीनेट एवं स्थायी समिति सदस्य भी है और डेक्कन एजुकेशन सोसाइटी पुणे विश्वविद्यालय के एथिकल कमिटी में भी आप योगदान दे रहे हैं। उन्होंने समृद्ध पशु संवर्धन इस पुस्तक का लेखन भी किया है तथा भारतीय किसान संघ वार्ता मासिक के संपादन से भी आप अनेक वर्षों तक जुड़े रहे हैं। इसके अतिरिक्त पशु आयुर्वेद, समग्र स्वास्थ्य एवं मृदा स्वास्थ्य विषयों पर व्याख्यान एवं सम्मेलन का आपने आयोजन किया है। इन्हीं शब्दों के साथ मैं अपनी वाणी को विराम देता हूं और आदरणीय संतोष जी को अनुरोध करता हूं कि वो मार्गदर्शन पर कुछ हमें प्रेरित करें। धन्यवाद।
धन्यवाद डॉक्टर मनोज चौधरी। सभी को नमस्कार। आयुर्वेदा अभ्यासनम की द्वारा आप सभी को मिलने का शुभ अवसर बार बार आता है। आज इस व्याख्यान श्रृंखला का क्रमांक 26वां है। आयुर्वेद के स्नातकों के लिए और प्रैक्टिशनर्स के लिए आरोग्य भारती के पश्चिम महाराष्ट्र प्रांत द्वारा आयोजित इस व्याख्यानमाला में आप सभी लोग सम्मिलित होकर अपने शास्त्र की अच्छी से सेवा कर रहे हैं, ऐसा मैं समझता हूं। आप इसमें सम्मिलित होकर आरोग्य भारती को ज्ञान सेवा का अवसर देकर आरोग्य भारती को ही उपकृत कर रहे हैं, ऐसा भी मेरा मानना है। आज के हमारे प्रमुख वक्ता डॉक्टर प्रदीप कुमार जी मोहराना तथा आरोग्य भारती के प्रांत कार्यकर्ता डॉक्टर मनोज चौधरी, डॉक्टर देवदत्त देशमुख, डॉक्टर राहुल गवळी, डॉक्टर कुंभारे, डॉक्टर आनंद मादगुंडी, डॉक्टर जय आड़े जैसे अनेक कार्यकर्ता इस व्याख्यानमाला का, आयुर्वेदाभ्यसनम का यशस्वी आयोजन कर रहे हैं। उद्घाटन के तौर पर इतना ही कहना चाहूंगा कि जब भी पेन मैनेजमेंट की बात मेरे सामने आ जाती है तो मुझे महर्षि चरकाचार्य के ग्रंथ का यानी चरक संहिता का शारीरिक स्थान अध्याय 1 के कुछ श्लोक याद आ जाते हैं। महर्षि अग्निवेश प्रश्न पूछते हैं भगवान पुनरोस्वात्रेय से, क्व चैता वेदना सर्वा निवृत्तिम यान्ति अशेषतः। कुछ भी बाकी न रहते हुए सारी वेदनाओं का पूर्ण अंत कहाँ कैसे होता है। और उसी अध्याय में एक श्लोक में उसी का उत्तर भगवान अत्रेय द्वारा सबको मिलता है। वह है योगे मोक्षे च सर्वासाम निवृत्तिम अशेषतः वेदना नाम अवर्तनम, ऐसा वो श्लोक है। तो चिकित्सा स्थान में सर्वश्रेष्ठ चरक संहिता है ही, लेकिन वेदनाओं का अंत पूरा के पूरा कैसे होगा, इसका उत्तर देने वाला ग्रंथ चरक स्थान होते हुए शारीरिक स्थान में इसका उत्तर मिलता है। योग और मोक्ष के द्वारा हम सब इस स्थिति में पहुंच सकते हैं कि वेदना फिर से वापस नहीं आए। क्या हम प्रैक्टिशनर, आयुर्वेद के स्नातक इस उत्तर का अनुसरण करने के लिए तैयार है? क्या हम वैद्य अपने रुग्णों को इस दिशा में प्रेरित करने के लिए तैयार है? अगर हम इस दिशा में जा रहे हैं, योगे मोक्षे च सर्वासाम, तो हम सही मार्ग पर है। आरोग्य भारती का यह अध्यापक श्रेणी का काम हो या विद्यार्थी श्रेणी का कार्य हो, आप सभी को इस दिशा में ले जाने का एक प्रयासवर्त है। आप सभी का सहभाग इसमें होते हुए आप सभी का धन्यवाद करना आवश्यक है। यह कहते हुए आज के उद्घाटन के अवसर पर जो दो शब्द कहने के लिए मुझे अवसर दिया गया, इसके लिए आप सभी का आभार व्यक्त करते हुए मैं यहाँ रुकता हूँ। धन्यवाद।
धन्यवाद सर। आपका खूब खूब आभार सर, आपने जो मार्गदर्शन दिया उसका। अब हम आज के विषय के तरफ जाएंगे। आयुर्वेद केवल रोग निवारण का माध्यम नहीं, बल्कि स्वस्थ जीवन जीने की संपूर्ण विज्ञान भी है। आज का हमारा विषय भी अत्यंत महत्वपूर्ण एवं क्लिनिकल दृष्टिकोण से उपयोगी है। मैनेजिंग लो बैक पेन थ्रू द आयुर्वेदा, अ प्रैक्टिकल क्लिनिकल अप्रोच। इसके संबंधित अब मैं आज के हमारे मुख्य वक्ता का परिचय प्रस्तुत करना चाहूंगा। हमारे बीच उपस्थित है आदरणीय डॉक्टर प्रदीप कुमार मोहराणा सर, जो आयुर्वेद के क्षेत्र में एक अत्यंत प्रतिष्ठित नाम है। सर ने एमडी काई चिकित्सा, पीएचडी काई चिकित्सा की उपाधि प्राप्त की है और वर्तमान में श्री जयेंद्र सरस्वती आयुर्वेद कॉलेज एंड हॉस्पिटल चेन्नई में पीजी विभाग काई चिकित्सा में प्रोफेसर के रूप में कार्यरत है। सर के पास सर के पास 23 वर्षों से ज्यादा का समृद्ध क्लिनिकल एवं टेक्निकल एक्सपीरियंस है। असंख्य विद्यार्थियों का मार्गदर्शन किया है सर ने, अंडर ग्रेजुएट एंड पोस्ट ग्रेजुएशन स्तर पर। वे एक रिकॉग्नाइज पीजी एंड पीएचडी गाइड भी हैं और देश के विभिन्न प्रतिष्ठित यूनिवर्सिटी में एग्जामिनर के रूप में भी अपनी सेवाएं दे चुके हैं। सर के अनेक क्लिनिकल ट्रायल और रिसर्च प्रोजेक्ट में प्रिंसिपल इन्वेस्टिगेटर के रूप में कार्य किए हैं और विशेष रूप से लो बैक पेन ग्रिड्रेसी लंबर डिसऑर्डर पर उनका कार्य अत्यंत उल्लेखनीय है। उनके द्वारा प्रकाशित रिसर्च पेपर एवं केस स्टडीज इंटरनेशनल जर्नल में प्रकाशित हुए हैं जो आयुर्वेद के क्लिनिकल एविडेंस को मजबूत बनाते हैं। रिकॉग्निशन एंड सर को उनके उत्कृष्ट कार्य के लिए बेस्ट डॉक्टर अवार्ड एवं बेस्ट पेपर प्रेजेंटेशन 2024 जैसे सम्मान से भी प्राप्त हुए हैं। इसके अतिरिक्त उन्होंने आयुर्वेद के विषय पर कई महत्वपूर्ण बुक्स भी लिखी है जो विद्यार्थियों के लिए अत्यंत उपयोगी है, जैसे क्लोजिंग इम्पैक्ट लाइन। सर का अनुभव, उनका शोध कार्य एवं क्लिनिकल दृष्टिकोण हम सभी के लिए आज के सत्र को अत्यंत विशेष और ज्ञानवर्धक बनाएगा। अब मैं विनम्रता पूर्वक आमंत्रित करता हूं आदरणीय डॉक्टर प्रदीप कुमार मोहराना सर को कि वे अपने अमूल्य विचारों से हमारे प्रत्यक्ष प्रस्तुत करें।
Sir, namaste to all. Good evening, respected dignitaries, teachers, and dear participants. First of all, I would like to express my sincere gratitude to the Arogya Bharati, Paschim Maharashtra, Pranta and team. I am very much thankful for giving me an opportunity to present my research topic, particularly the low back pain, how to manage through Ayurveda, a practical clinical approach. So I'll be discussing this topic over a period of around 60 minutes. So in the beginning itself, I'm telling you that low back pain is one of the most common complaint encountered in the day-to-day clinical practice, and it affects the quality of life and daily functioning also. So 90% of the low back pain does not require any type of treatment. They resolve automatically. But whenever there is a heaviness or stiffness or numbness in the lower limb, so that time only we need a consultation of either orthopedician or Ayurveda physician. So in that manner. So before going to tell about the topic, I want to tell you, I will be telling about the definition, how the vertebral column is added, and what is the role of the disc. Then I will be coming to the Ayurveda practical approach, what exactly we are giving in our hospital. So let me start with the definition. So low back pain is a pain, discomfort or stiffness in the lumbar region located between the lower rib margin and proximal thigh. So particularly it is confined mostly to the lumbosacral area. So as you know, there are 5 lumbar vertebrae and sacrum 4 vertebrae which are fused into one. So in that only in between that lumbosacral area, if the pain is confined, then only we can call it as low back pain. So as you know, when the low back pain affects, so before going to discuss about the low back pain in detail, so let me start with a little bit anatomy of the vertebral column and the vertebra and disc. So as you know, there are 33 unfused vertebrae: cervical 7, thoracic 12, lumbar 5, sacrum 5, and coccyx 4. So when they are fused, they become 26. Next slide, please. There are 5 lumbar vertebrae. Out of these 5 lumbar vertebrae, the L1 to L4 is typical vertebra, and L5 in between the 5 lumbar vertebrae, the L5 is larger, thicker, and it has a pyramidal body with a shorter spinous process. So as you know, the vertebra will be having near about 11 parts of the body, 7 processes, the vertebral foramen, and there are 4 articular facets. So in this category, particularly in the lumbosacral area, it is the lumbar vertebra are the largest and strongest vertebra, and it bears the maximum body weight, and it is a primary site involved in the low back pain. Next, sir. So before going to tell you about the vertebral column, there are there are 2 lordotic curvature and 2 kyphotic curvature. So in relation to the in relation to the cervical, thoracic, lumbar, and sacral, there are two lordotic curvature which is commonly found in the cervical and lumbar area, where the two kyphotic curvature where thoracic and sacral area it is seen. So due to this lordotic curvature of the spine, the human being is subjected to have a neck pain and back pain. Next slide. So this is one of the picture I have presented you in the lumbosacral area, where exactly there are near about 7 processes and other 4 parts. So in total, including all, it will be 11 parts. So in between L1 and L5, there are some discs. So next slide only will be telling about the disc. Okay. So there are 23 intervertebral discs are there. In between C1 and C2, particularly the atlas and axis, there is no intervertebral disc. The disc is composed of 2 layers. The outer layer is called as annulus fibrosus and the inner layer is nucleus pulposus. The nucleus pulposus is a gel-like collagen type 2 chondrocytes, proteoglycan rich, and it is composed of 80% water, which is acting as a shock absorber. The outer ring is composed by the annulus fibrosus. So here fibrosus means there are more amount of fibrinocytes are there, and it is a tough concentric ring structure. It is composed of type 1 and type 2 collagen, where it contains only 60% of water. So with age, when the age advances, the water content of the disc decreases. So it becomes thin and fibrous tissue and cartilage cells increase. So that's why it becomes hard. So it is a common problem after the age of 65 years. When the disc is undergoing degeneration or there are some traumatic injury to the disc, there will be 4 types of problem. That is BPES, bulge, prolapse, extruded, and sequestrated. So in this picture, actually, the normal disc is given, then degenerative disc, bulging disc, herniated disc, and thinning disc. And this degeneration with osteophyte formation, which is commonly found in the osteoarthritis of the lumbosacral joint. Next slide. So this is what the picture tells you about the number. One is the first picture is normal lumbar disc. The next one is protrusion. Next one is extrusion. So in between protrusion and extrusion, the basic difference is the protrusion is within the vertebral foramen, but it does not compresses the spinal cord. Where extruded, it compresses the spinal cord, and where the anterior posterior diameter becomes less. And in this sequestration, the disc is particularly the outer part of the disc is divided into 2 segments, and one segment lodged in the spinal cord. So that's why it requires immediate operation. So this the Ayurveda people or all the orthopedic medicinally, whatever we can manage, that is the bulge, prolapse, and extruded. But sequestration needs an immediate operation. Otherwise, there will be a permanent problem. Next. Next, please. So now I'm going to tell you about the sciatic nerve. Why I'm talking about the sciatic nerve? Because the root value of the sciatic nerve starts from the L4 and it ends in the S3. So the root value of the sciatic nerve is L4, L5, S1, S2, S3. So the sciatic nerve originates from the greater sciatic foramen. It is 2 centimeters wide at its origin point. Just before the popliteal fossa, it divides into 2 branches. One is common peroneal and tibial nerve. Now I am going to tell you about how it innervates the muscles. So the sciatic nerve provides the motor innervation to the posterior compartment of the thigh. So it includes 3 muscles: biceps femoris, semimembranosus, semitendinosus. The ischial part of the sciatic nerve supplies to adductor magnus and adductor brevis, which is helping for the knee flexion and hip adduction. Just before the popliteal fossa, this sciatic nerve divides into 2 branches. One is common peroneal nerve, another is tibial nerve. The tibial nerve supplies to the posterior compartment of the leg, where it supplies 7 muscles. That is gastrocnemius, soleus, plantaris, popliteus, flexor hallucis longus, flexor digitorum longus, then tibialis posterior. So this is particularly helping for the plantar flexion and the flexion of the toes. Where the peroneal nerve supplies the anterior and lateral compartment of the thigh, it includes the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and fibularis tertius. The lateral compartment of the sciatic nerve, it supplies the peroneus longus and peroneus brevis, which is helping for the foot eversion. So this is in detail about the anatomy of the sciatic nerve and how it supplies to the particular muscles. So the etiological factor, particularly whenever you are lifting any weight, so it requires a proper position. If you are deviating from the proper position, the disc either it becomes bulge or prolapse or extruded. Sometimes it also sequestrated. So the monotonous work, particularly working overtime and improper postural habits, obesity, then women with greater number of pregnancy and stressful occupation, anxiety, depression, smoking, operation of the motor vehicles, use of machine tools. So these are the factors which leads to the low back pain. Next. So the low back pain causes, you can just remember one mnemonic that is called as CITINMRD, CTNMRD. So C stands for congenital, which includes two 3 digits, that is spina bifida, scoliosis, spondylolysis. The I stands for infective, osteomyelitis, and tuberculosis. As you know, the osteomyelitis, particularly, it causes the lateral part of the lumbar spine, and it so tuberculosis also affects the spine, and it causes support spine. The traumatic vertebral injury, muscle sprain, or any disc prolapse due to any road traffic accident or a history of fall or injury. The inflammatory category comes under rheumatoid arthritis and ankylosing spondylitis. So these are called as autoimmune related causes for the low back pain. Next one is neoplasm. As you know, the neoplasm means the new growth. So it is abnormal, uncoordinated, purposeless proliferation of the cell. So there will be abnormal cells are accumulated in a particular part. So it includes two things. One is osteoma, then multiple myeloma. So this osteoma is bone tumor, and multiple myeloma, it is spreading all over the body, the tumor mass. The metabolic is due to the deficiency of the calcium and vitamin D3, which leads to osteoporosis and osteomalacia. And the R1 is referred, that is either it is GI originated, if you are having any long intestine problem or small intestine problem, particularly bulbar loss or acute intestinal obstruction, that also leads to back pain. Then gynec related, particularly fallopian tube, ovary, and uterus related problem also causes referred low back pain. Then genitourinary, particularly the kidney stones and the nephrolithiasis, particularly the nephrotic syndrome, all the things also related to the referred low back pain. The last one is D, that is degenerative. So it is degenerative of the lumbar spine, which is normally we call as lumbar spondylosis, that is OA, and osteoarthritis and lumbar spondylosis. So these are the causes you can remember for the low back pain. So CITINMRD. Next slide. So this particular, the degenerative changes make the disc susceptible to trauma. Any trauma which suddenly increases the pressure will be resulting in a injury to the particularly the annulus fibrosus or annulus pulposus. And particularly whenever you are not properly weightlifting, or there is a fall, or there is a direct trauma to the back also, that also leads to low back pain. So disc may rupture during pregnancy, labor, and after prolonged bed rest due to disc softening. Disc rupture without any cause is due to degenerative ulcers. Now I am telling you how much load the vertebral column is getting when you are standing is 100%. Whenever you are sitting, there is 145% pressure you are putting on your vertebral column. Standing with forward bend, in your about 150%, and standing with forward sitting with forward bend also 180%. So load is better supported sitting than unsupported sitting. So lumbar support decreases the load. So whenever you are lying down on the bed, particularly it gives blood supply to the vertebral column due to the presence of the micropapillaries in the vertebral column, and that gives only 25%. So normally whenever you are having back pain and you are lying down, the most of the pains are relieved. Next one. So this particularly the low back pain, which is in relation to sciatica syndrome, it comes under the classification of ICD, International Classification of Disease 11, ME 84.20. So the clinical feature, either it may be confined to the low back pain, or there may be a radiculopathy, or there may be a nerve root compression. So I'm going to tell you about some formulas you can remember in the next slide, that whenever the L4 is damaged, the particularly it will affect the four things, that is quadriceps femoris. And whenever the L5 is damaged, then you will be getting, there will be 5 fingers. So you will be getting either numbness or heaviness in the 5 fingers. Next one. See, so that's why I told you L4 stands for the quadriceps femoris, where the knee jerk is lost. L5, the root involvement, wherever the 5 toes are involved, particularly the great toe and the lateral. So that's why in great toe, in relation to the great toe, 2 muscles are involved. One is extensor hallucis longus and flexor hallucis longus. So you have to do the power test, whether EHL or FHL power is lost or not during the lumbar disc diseases. S1, particularly whenever it is involved, then it is ankle jerk is lost. I am just telling one mnemonic. One is 1, 2, buckle my shoe. 3, 4, kick the door. So this is 1 and 2, particularly the ankle jerk related. That is when buckle my shoe. That is you are putting or tying your lace in the shoe. So that's why you need the ankle reflex. When 3, 4, kick the door, you need to kick the door means your knee reflex should be perfect. Then only it will be possible. So this is as far as in relation to the L4, L5, S1. Remember, out of this problem, the L4 and L5 problem is more common, and it is mostly 95%. And in that particular, the L5 nerve involvement will be almost 80 to 90% in all types of back pain. Next one. So there are red flag signs in the back pain. So just there is a mnemonic called as TUNAFIS, TUNAFIS. So trauma, unexplained weight loss, neurological symptoms. The neurological symptoms, particularly in relation to the whenever there is a urgency or hesitancy of the bladder and bowel, and if the person's age is more than 50 years and it is associated with continuous fever, and if he is using any intravenous drug use or any steroid use, or any history of cancer in the form of osteoma, osteosarcoma, or multiple myeloma. So these are the red flag sign in the back pain. So once I'm telling you the L4, you ask the patient to squat and rise. The L5, you ask the patient to walk on the hill, and if it is S1, you have to ask that he should walk in the with the help of the toe. So toe walking. So these are the three things you can differentiate whether L4 is involved or L5 is involved or S1 is involved. Next slide, please. So diagnosis. So how to diagnose? The common diagnosis of the low back pain. Here the myofascial pain, spondylosis, spondylolisthesis, facet syndrome, fibromyalgia, lumbar canal stenosis. So these are the things you have to differentiate. So only in 50% of 15% of the cases of the low back, accurate diagnosis of a specific cause can be made. Otherwise, you can have a general terminology called as lumbar PIBD or lumbar radiculopathy. So you can use a broad terminology. Next one. So the best investigation actually for the any type of low back pain. So you can start first with an X-ray of lumbosacral spine, AP and lateral view, and the next one you can go for a MRI of the lumbar spine with whole spine screening. So usually those who are having a history of low back pain, so due to compensation or compensatory pain, there will be also neck pain will be there because of this two lordotic curvature, LCL. The lordotic curvature seen in the cervical and lumbar area. That's why I'm telling you, whenever you are doing an MRI, please do MRI of lumbosacral spine along with the whole spine screening. then you can go for the CT scan. You can identify the particularly the parts of the which part of the vertebra is damaged. Next one, sir. Next, please. See, this is on X-ray where the disc space is reduced and there are degenerative changes, and in the left side there is a scoliotic changes. Actually, the bend there is a scoliotic changes seen in the lumbar spine, and it particularly whenever a person is suffering from osteoporosis or osteomalacia for a long time, and after the age of 65 years, so this type of problem will be common. So this X-ray, you can identify the disc space is reduced, the presence of osteophytes is there. Then you see in between two things, that is the L4 and L5. L4 is protruded anteriorly and L5 is protruded posteriorly. So whenever you come to the disc, you remember anteriorly the disc is thick and posteriorly it is thin. So the posterolateral disc bulge is common found during the clinical practice. Next slide. I'm going to tell you some terminology which might confuse you regarding the understanding of the spondylitis, spondylosis, spondylolysis, and spondylolisthesis. So spondylitis is just one inflammation. So any inflammation will be characterized by 5 things: rubor, calor, dolor, tumor, and functionosa. Spondylosis means it is a degenerative. So wherever OCC is there means it stands for the degeneration. So degeneration means there will be spikes or the presence of osteophytes or spurs will be there. Where spondylolysis, it is mostly due to the deficiency of vitamin D and calcium, and particularly whenever a person suffers from any type of stress fracture or any tuberculosis. So this type of thing. So in spondylolysis, you will be getting the defect in the pars interarticularis. In spondylolisthesis, either the disc is slipped forward or backward. So this is called as vertebral or slip disc, it is called as. So spondylitis stands for inflammation, spondylosis stands for the degeneration, spondylolysis is defect in the pars interarticularis, and spondylolisthesis means slip disc or the disc is either anteriorly protruded or posteriorly protruded, and mostly it is anteriorly protruded. Next one. So these are pars interarticularis defect, spondylolysis, spondylolisthesis, and spondylitis. So these are the some pictures which you can find out in the MRI spine. Next one. Next, please. So here I'm going to tell you about another terminology. One is called as lumbarization and sacralization. So the common is sacralization. So common is sacralization means the L5 is fused into sacrum, and there is a complete fusion in between the L5 and sacrum. So that is called as sacralization. When you come to the lumbarization means the sacrum, which is actually fused one. 4 bones are fused into one. The sacrum will be behaving, it is different. The first S1 will be coming as a L6, that is the 6th lumbar vertebra. It looks like that there are 6 lumbar vertebra, but actually there is not. So that is called as lumbarization. And in this sacralization and lumbarization, the sacralization seen in the 95% of the cases, and hardly 2 to 3% of the cases you may get lumbarization. But both are problem, and the commonest problem is lumbarization. Next one. So already I told you lumbarization occurs when the sacral vertebra fails to fuse and creating a 6th lumbar vertebra seen in the 2% of the population. And sacralization is the fusion of 5th lumbar vertebra to the sacrum. So reducing the lumbar to 4 functional vertebra, it is the commonest problem seen in the 95% of the cases. Next one. So this is one of the MRI shows that there is a fracture. So this fracture may be related to the deficiency of calcium or vitamin D3, or there may be a stress fracture, or there may be a history of accident, or there is a history of fall. So this you will be getting clearly in between the vertebra, there is a breakage. So discontinuity in the lining of the bone surface leads to a fracture. So MRI and X-ray, in both you can identify the fracture. Next one. So apart from this other causes like CI, TI, NMRD, uh, I'm going to tell you about there are some spinal deformities, particularly the scoliosis, kyphosis, or lordosis. So these all problems, either scoliosis or kyphosis or lordosis, any problem leads to back pain, low back pain. Next one, sir. So now how to diagnose the low back pain, whether it is related to the L4, L5 or L5S1. So there are some tests which you can confirm that particular disc level is involved. The slump test, it is a sitting bent forward and extending one leg and then the other. So it signifies that L4, L5 and L5S1 is there are problems. The SLR, normally we do the SLR test. So whenever we are doing SLR test, the maximum, the minimum is 70 degree. If you have more than 70 degree, it is negative. Below 70 degree, it is positive. So it indicates then again the L4, L5 and L5S1 problem. The next one is Faber's test, or it is a Patrick test. It is a physical examination used to detect the hips, whether sacroiliac joint involvement is there along with the lumbar intervertebral disc or not. So that is called as Faber's test. So Faber stands for flexion, abduction, and external rotation. So it is you can identify whether it is associated with the low back pain, associated with the hip pain or not. So this is a very important test to identify or to rule out the pathology of sacroiliac joint. The next one is Braga test. The SLR, after doing the SLR, you have to dorsiflex the foot. Whenever you are dorsiflex the foot, automatically the sciatic nerve gets stretched, and again the patient tells you that I am having more pain. So this indicates particularly the L5 and S1 disc prolapse. So slump test is confined both L4, L5. SLR is also L4, L5. Faber to identify or to rule out the hip pathology, and Bragard is particularly helpful for the diagnosis of L5S1. Next one. So now I am coming to the Ayurveda part, where I will be telling you how the Vata dosha. So before going to tell you about the Vata dosha, let me start with a sloka called as from Susru Samhita, that is Bata trute nasti ruja nari no paripaka kale pita trute nasti kapancha puya. So wherever there is a pain, Bata trute nasti ruja. So wherever there is a pain, there is involvement of the wife. So in Charaka Samhita, it is called as Vayu Ayurvalam, Vayur Dhata, Sarinam, Vayu Vishwamidam, Sarva Prabhu Vayu Samhita. So everything, whatever the activity or everything in the life, it is controlled by the Vayu. And the Pathasthana is Pakwasa Ekati Sakti, Srotastri, Pasamendriyam, Sthanam Vatasya Tatrapi Pakwasa Vishesata. So Pakwasa is the Asaya wherever the Vatasthana is normally situated. Next one. As you know, there are 5 types of Vayu. So Prana, Dana, Samanaga, Bana, Panaisa, Panchada, Dehe Tantra, Samyak, Stanesu, Behatascharan. So these are Prana, Udana, Bana, Samana, Apana. So these all the Vayu. You know, Pita Pangu, Kapapangu, Pangavo, Maladhatava, Vaina Jatra, Nyante, Tatra, Gatsanti, Megava. This is contributed by Sarangdar Samhita. So all the things, the propeller is Vayu dosha. Without Vayu dosha, we cannot move it. Next one. Okay. So whenever the Vata is either aggravated, so that is or impaired, so they afflict the body with the disease specific to the location and focus. So Bimargasta hi yukta var ho gayi swasthana karma jayi shariram pidayantana prana nasu haranti. So when it is dislodged or impaired, the dosa particular harm the body by diseases according to their respective site and function, it may lead to the instantaneous death. Next one. So as you know, there are 18 anatmas of Vata Vikaras are mentioned, and the place of Gidrasi is number 9. It starts with Nakaveda and it ends with Anavasthita Chitatva. And particularly the Katisula or Katigraha word is not used by Charaka Samhita. The Katigraha was contributed by Gadanigraha. So in the out of 18 Anatmasavati, the Gidrasi place is number 9. And remember, this Gidrasi is coming under both Samanya Zavadi and Anatmasavadi. So Nanatmaja Vyadi, no Anatmaja, that is no Atmaja, which means only one dosha involvement. So that is called as one is Gidrasi, and it is of two types, Vataja and Vata Kaphaja. That is comes under Samanya. So Gidrasi comes under Nanatmaja Vata Vyadi as well as Samanya Vyadi. So Katishula Katigraha is not mentioned by Acharya Charaka, rather than Prushtagraha and Trikagraha has been mentioned. Next one, sir. Next, please. So now I'm going to already I told you the sthana of the vata is Pakwasa. So whenever the aggravated vayu lodged in the Pakwasa is to antrakujam sula atopo karoti cha kuchra mutra purishatam anaham trikavedana. So here they have not used the kati vedana, they have used the word trikavedana, and it is associated with, I already told you, whenever there is urgency or hesitancy of the bladder and bowel, that is kuchra mutra purishatam anaham. It is usually causes constipation and different types of intestinal burbogamy. So it also includes Dantra Kujana, Sula, and Atopa. So these are the things which are related to the Pakwasakatavata. Next one. So whenever we are going to discuss about the Vata Vyadi, so the Vata Vyadi, it is a large, you can tell it is a big umbrella where it includes the neurological disorder and musculoskeletal disorder. So Kriyamatam Param Siddham Bhatoroga Paham Sunu Kevala Nirupastambam Adau Sneha Upasara. If it is either Kevalam or without any obstruction, that is Nirustambam, then you have to first start with the Snehana Karma. So what type of Snehana? Bayuhu Sarpi Vasa Taila Madja Panei Narai Tata. So you can go with this Taila Pana or Sarpipana or Vasapana. So this it will be leading to Sneha Klanta Samaswasya. After Snehana, after 7 days of Snehana, you can go for Payovi Sneha with Puna. Again, you can give the milk. And the milk should be associated with Jusai, Gramya, Anupaja, Rasai, Sneha Sanjukti, Payasahi, Kusare, Samla, Madhura Amla Lavana. It is related to the Vata Rogahara. So you can go with that Madhura Amla Lavana Rasahara, and you can go for the Anuvasana. So these are the initial line of treatment in general, not particular, in general line of treatment for the Vata Vyadi. Next one, sir. Next, please. So this is the reference, actually it is from Charaka Samhita. So next chapter I am going to tell you, Bayor Dhatukshyat Kopa Margasya Abranamso. Wow. So Bayu gets aggravated in two conditions, either it is Dhatukshaya or Marga Avaroda. So in Dhatukshaya, you might be knowing the Samprati of Rajakshma. Kapha Pradhani Dusaitu Ruddhesu Rasavatmesu Ati Vavaina Vapi Khine Ratasya Nantaraha Khyante Dhatava Sarve Tataha Suchyate Manava. So there are two types of Kshaya, either it is Anulamakshaya or Patilamakshaya. So the both type of Kshaya leads to Vata Vyadi. So Bayor Dhatukshat Kopo Margasya Abranatsa. So whenever there is Ati Prabhuti Sangova, Siranam Grantha Viva, Bimargagaman Chapi Sruta Sandushti Lakshana. So Bayor Dhatukshat Kopo Margasa. Vayu gets aggravated in two conditions. One is Dhatuksha and another Margavaro. So Vata Pitta Kapha Dehe Sarva Sruta Anusarina. So whenever this Vatava Srutas or Pittava Srutas, they are present all over the body. Vayu Reva due to the Sukma nature or it is subtle nature. Dvesta Tatrapi Udirana. And it is having a propelling character and Kupista Samudbhuya Tatra Kipanu. So yeah, already I told you. Pitapangu, Kapapangu, Pango Moladata, Bayuna Jatra and the Tatra Gachatimata. So Karoti Abruta Margata, Rasadista society. So whenever it affects the Anulomoksha, it leads to Anulomoksha and it leads to Dhatu Sosan. So this is the Avarana concept of the Vata Vyadi. Next one, sir. Next one, please. So now I am coming to the Gidrasi. Already I told you the Gidrasi is described under it is placed ninth in the 18 Anatmaja Vata Vyadi. So it starts with Spik Purba, Kati Prushta Uru Janu Jangha Padam Kramat, Gidrasi Stamba Ruk Tode Grunati Spandate Muhu, Vata Kapha, Tandra Gaurava Ro Chakanita. So Spik Purba, it starts from the buttocks as the sciatic nerve supplies the motor innervation to the posterior compartment of the thigh and the lower limb. So that also Speak Purba Kati Prusta Uru Janu Janga Padam Krama. So it comes in the posterior aspect. So it leads to either it is Tamba or there is a numbness. So it may be starting, it may be of two types. One is Vata, pure Vata's origin, or it is maybe a Vata Kapha origin. Next one, sir. Next one, please. So the line of treatment from the Kayachikitsa, that is from Charaka Chikitsa San 28th chapter. Antara Kandara Gulfa Shira Vasti Agni Karmam. So here it is, either you can go for Agni Karma in between the Kandara which is present in the Gulfa. There you can go for Agni Karma, or you can go with the Vasti Karma. So Gudrasisi Prajujita. So this that is Antara Kandara Gulfa Shira Vasti Agni Karma. So Gudrasi Praje Khali Trishna Upana. For the Khali Trishna Upana, you have to go. So you can go for either Shira Veda or Agni Karma. Next one. So I already told you the Kati Graha and Kati Sula is not described by Charaka Samhita. So rather than it is contributed by Gadani Graha Vataro Adhigara. That is Katyasrita Sudha Sa Amova Janai Trujam Kati Graha Sa Vigyaha Pangu Sakti Daya Asrita. So whenever there is Sakti, the lower both the lower limb, it leads to Pangu. Whenever the pain is confined to the Kati, and it may or may not be associated with the Ama, and it produces pain in the lumbosacral area, then you can call it as Katigraha. So you can call it as a Katigraha pain, lumbosacral pain, along with stiffness or heaviness in the lower limb. You can call it as Katigraha. Next one, sir. So in our hospital, we prescribe near about in between the permutation and combination of 4 Kasayams and 4 Gugulus, along with that some toilets. So we manage most of these balls, prolapse and extruded cases. So the anterior posterior diameter, if it is less than 7, the result will be not encouraging. So what I'm telling you, before going to admit the patient, you should see the anterior posterior diameter of the vertebral canal, where the L4, L5 and L5S1, it should not be less than 7. If it is less than 7, then definitely there will be a neurological involvement, particularly the bladder and bowel involvement will be there. So we use 4 kasams. I am going to tell you one by one kasam. Rasna Saptakam, Gandharavasta, Sahachara. So these are the kasams we use normally in our hospital. So in Rasna Saptaka, where you are using, it composed of Rasna Amurta Aragodha Devadaru Trikanda Eranda Punarnava, Kwatham Pibet Nagarchunamsra. If the person is very lean and thin and pure Vata's origin, then and it is the pain is confined to the lumbosacral area and it is not radiating, then we choose the Rasna Saptakam Kasa. Okay, next one, sir. This Gandharvastadi, I told you, it is particularly whenever it is indicated when the Pakwasa is involved and the patient is having a more involvement of the large intestine, means there is a history of constipation. So mostly those patients who are coming for the lower back pain, they will be having a history of constipation. So initially it is given to alleviate the aggravated Vata dosa which is situated in the Pakwasa. So it is composed of Gandharvasta, Chirabilla, Hatasa, Visho, Pathya Punarnava, Saka Bhumi Tarahi, Kwatha, Saindava Gudaha, Pavanasya Sante. So Pavanasya Sante. So this is Banir Vadaya, Ruchi, Malosodana. So these are the things which are particularly we are giving whenever there is a history of constipation and the pain is mostly confined to the lumbosacral area, then we use Gandharvastadi Kasaya. Next one. Next. This is a very famous sloka. It is found in the Vaishya Ratnavali. Dasamuri Balarasana Guruchi Vishwavesadam Pive Teranda Tadano Vidracha Kanjabos. You can blindly you can prescribe this medicine to all types of low back pain cases, whether Vata is involved or Pitta is involved or Kapha is involved. It is not a matter. So this is in general kasayam which you can use Dasamuri, Bala, Rasna, Guruchi, Vishwavesadam. So all the Vatahara medicines, Pibet, Eranda Tadano. So Eranda is also there. So it is particularly mentioned Gidrasi Kanjapangu. Gidrasi, particularly lower limb disorders, anything you can go blindly within Dasamula kasayam, irrespective of the amount of Vata or amount of Pitta or amount of Kapha is involved. Next one, sir. Next one is Sahasrari Kasaya. So wherever the pain is confined and it is radiating, particularly the upper thigh, then we can go for with Sahasrari Kasaya. Sahasaram, Surodaru, Sonagaram, Kwatitambasi, Tala Bimisritam, Pavana Pidita Dehegati, Piven, Druta Bilambato, Bhavati Chaya. So it is the reference is from Ashtanga Kayachikitsa, 21st chapter, and it is very effective in the lower back pain, particular joint pain, swelling, and helps in the muscle pain and wherever bursitis is there. So it is particularly indicated in lumbar spondylitis. Sahasrari Kasaya is indicated, and wherever Vata is more, Pitta is less, and Kapha is less, then we can use Sahasrari Kasaya. Next one. Now I'm coming to the gugulu preparation. We use there are about 3-4 gugulus. So out of that, one is Yogaraja gugulu. So Yogaraja gugulu is used frequently in the lumbar and cervical spondylosis. So wherever the degeneration along with pain is there, then we can go for this Yogaraja gugulu. It helps in the disc tissue degeneration and it acts like more pain reliever. So it is particularly indicated whenever Vata is more, Pitta is less. So there we are using Yogaraja gugulu. Next one. Next. Troyodoshan gugulu particularly indicated whenever a person is lean and thin and having a severe back pain. So it is indicated particularly Katigrahe, Gdrasi, Bahu Bruste, Hanugrahe, Januni Padajugma. So it can be having a broad indication. Wherever Pitta is more and Vata is less, we can go with Troyodoshan gugulu. So particularly how to analyze this Vata Pitta Kapha in relation to the pain, stiffness and burning sensation, or there is a history of numbness. So in that aspect you can find out whether Vata is involved or Pitta is involved and Kapha is. See, all despite of all the things, without Vata nothing is possible. So Vata Bhute Nasti Raja. So Vata is important. So mostly Vata, Pitta, Kapha. Next one. So wherever Vata predominant, Troyodoshan gugulu, Pitta predominant, Mahajogaraja gugulu, then wherever there is a Marga Varodha, that is particularly the Avarana part, we use Singanada gugulu. So these are the indications we do with permutation and combination of some kasayams and gugulus along with some toilums. Next one. Next please. So you know, Nasti Toilat Param Kinchit Ausadam Marutapaham. Bebai, Usma, Guru, Sneha, Sanskarat, Balabataram. As you know, the Sneho Anida Hanti Mrudu Karati Binihati Sangam. So Sneha or Snehana Karma is the best karma, and we use mostly with 5 toilams. That is Dhanandar Tala, Murivena, Pinda Tala, Mahamasa Tala, and Balavasanda Tala. We use this toilams for this type of back pain. Next one. So apart from the back pain, Snehana Karma, we go for Anuvasana Vasti and Kativasti. So this is one example of a Kativasti, how the Kativasti is helpful for the management of the low back pain. It stimulates the nerve and it always, it is the penetrate also to the inner area, removal of hammer, strengthening the lumbar area, and psychologically you will be getting a good relief that something is given to my lumbosacral area. And the patient is lying down for a period of 30 to 45 minutes in a particular position. So this is more or less compared to the psychological action, as well as it is also some soothing effect to the irritated nerves. Next one, sir. Next, please. So now I'm going to tell you about the Vasti. As you know, the Vasti is Abdha Chikitsa. Sakhagataha Koshtagata Roga Marma Urdha Sarvanga Vyavastha Ye Santi Tesam Nahi Kaschitanya Bayo Param Janmati Heturasti Binmutra Pitadi Malasana Vikshepa Sankata Karaya Tasmat Ativrudasya Samaya Nanat Vasti Vina Vesadum Tasmat Chikistam Abdamiti Bruvanti Chikista Mevi Vasti Meke. So whenever you go with Anuvasana Vasti or Niroha Vasti, so in Niroha Vasti there are 5 ingredients. Purbomi Dadyat Madhu. First one is Madhu. Then second one is Saindavam, Sneha, Binirmatya Toto Anukulkam. Then Kalka. Then Bimatya Sandhi Punardavista Vastu Nidhat Madhitar Khachana. So Madhu, Saindava, Kalka, Sneha, and Kasayam is given, particularly in the form of Yogavasti. Next one, sir. Next one. Next, please. So we do Yogavasti, particularly a period of 9 to 10 days of treatment. So where you start with the first day, you start with Anuvasanavasti, second day Niruha. Then again we follow the classical Yogavasti. So in Anuvasanavasti ingredient, mostly we give Mahanaran Tala or Dhanantar Talam or Gugul Tikta Grutam. So these are the things we follow in our hospital, and 95% of the patients, they are having a very good relief, and particularly we do not accept those who are having a neurological involvement is there, particularly the bladder and bowel. Next one, sir, please. So I'm just going to tell you about a case study. It will take 5 to 10 minutes. Okay. So it is a case of Mr. Sakila who is suffering from grade 2 anterolisthesis. Next one, sir. Next, please. Okay. So the patient demographic, she is aged about 55 years, female, and she's having four clinical features. That is low back pain radiating to the left lower limb into 5 months, burning sensation in the lower extremity, difficulty in walking, and disturbed sleep due to pain. Next one, sir. Next, please. So we do whatever the test already I told you, SLR, Bragard, Pebos test, all are positive in this case. So next one. So in the MRI, we got grade 2 anterolisthesis of L5 over S1, and the anteroposterior diameter is about 8.4. Then disc bulge at L5S1 causing the canal narrowing, and mild disc bulge at L4, L5. So L4 hemangioma also there, but hemangioma is not a problem for us. Next one. Next one, please. So the modern diagnosis is lumbar spondylolisthesis with sciatica, and focus is particularly the mechanism is L5S1 forward slippage resulting in physical nerve root compression. In Ayurveda, it can be correlated with Gidrasi, which is mainly Vata Kapa's origin, and Vata aggravation causing radiating nerve pain, and Kapha causing localized stiffness and restricted movement. So you can call it as the Vata Kapa's Gidrasi, which can be correlated with the lumbar spondylosis, listhesis, and it is grade 2. Next one. So we have given some medicines like Maharasana, Kasayam, Yogaraj, Gugulu. Then we have gone for the Purvakarma, that is Abhyanga and Swedana. Then we have gone for the Yogavasti. So it is a holistic management of the low back pain which we are following in our hospital, and we are getting good result also. Next one. So Swedana and Abhyanga, then we have given some oral medicine also, Saman Ausadi like Yogaraj Gulu Maharasana Kasaya. So this all total, along with Purvakarma plus Vasti, then some oral medication, giving a definite approach, particularly a conservative management for the low back pain. So we are getting a very good result. So the combined therapeutic vector simultaneously addresses the physical rigidity and neurological irritation without altering the skeletal structure. Next one, please. So the clinical outcomes, what we expect, actually the pain should be relieved. As you know, the pain is an unpleasant sensation which cannot be expressed in words. So when a person is complaining of pain, you can go with site, origin, whether it is radiating, whether what are the aggravating factor, like Socrates mnemonics are there, and whether the gait is improved, mobility is improved, and whether the sleep quality is improved or not, and whether pain relief is there significantly, whether it is radiating pain or it is a numbness pain. So whether that is reduced or not. So these are the things we look into that. Next one. So Ayurvedic management achieved complete functional recovery, restoring gait, sleep, and pain relief by resolving localized inflammation and Vata Kapha imbalance. So this case demonstrates that profound neurological symptomatic relief can be achieved conservatively without the need to physically reverse or surgically stabilize a grade 2 structural anterolisthesis. Thank you. Thank you all for your present hearing. So I'm very much thankful to the organizer for giving an opportunity. Thank you, sir. And thank you, audiences, and thank you all the participants, whoever is present in this webinar. थैंक यू सर।
थैंक यू सर, धन्यवाद सर आपका भी। आपने अत्यंत व्यवहारिक एवं ज्ञानवर्धक तरीके से विषय को प्रस्तुत किया। अब हम नेक्स्ट सेशन की ओर तरफ बढ़ते हैं कि जो प्रश्नोत्तर है। प्रश्नोत्तर सत्र की ओर बढ़ते हैं। यदि किसी प्रतिभागी के मन में कोई प्रश्न हो तो कृपया अपना प्रश्न प्रस्तुत करें। एनीवन? अनम्यूट करके वो पूछ सकते हैं अपना प्रश्न, एक एक।
दशमलव कैसा है, यू कैन बी गिवन 15 to 20 ml morning and night before food, 30 minutes before food, along with 100 ml of water, hot water, lukewarm water. So 15 to 20 ml you can give, sir.
ओके सर। किसी और प्रश्न किसी और का? सर मॉडर्न ट्रीटमेंट के बारे में पूछ रहे हैं सर।
Sir, modern treatment actually they do first they advise for the bed rest, then they go for with IFT and IPT, the interferential therapy, then go the pelvic traction. Then if it is not stabilized, then they go for decompression surgery. Either they go for laminectomy or foraminectomy, or they go with the decompression surgery. So these are the options available from the orthopedic point of view.
सर डीजनरेशन के बाद सर आयुर्वेद के प्रोग्नोसिस मतलब कितनी देर लगती है सर पेशेंट को ठीक होने में, मतलब
So
ट्रीटमेंट के बाद?
minimum it takes 2 to 3 months, sir,
ओके सर।
to have a complete recovery. As long as there is a degeneration and you are giving some supplements in the form of vitamin D, particularly the Sukti Vasma or Pravala Vasmam, or in the form of some capsules, Gandhadalam capsules or oxygen capsules, something you give, then it takes minimum 2 to 3 months. As you know, the BMD osteopenia, and it requires a minimum 3 months. So minimum 3 months of oral medicine has to be given. Then only will be getting some line of some amount of relief in the degenerative joint diseases.
ओके सर। सर एक और प्रश्न था सर मेरा
Yes, sir. Bolliye.
कि सर जैसे कोई पेशेंट है जिसकी शिफ्टिंग ड्यूटी है, कभी डे में है कभी नाइट में है, कोई पर्टिकुलर टाइम शेड्यूल नहीं है। एक पेशेंट ऐसा है, उसको गृद्रसी है,
हाँ.
सायाटिका है। तो सर ऐसे पेशेंट को कैसे डील करें? अब उसकी ड्यूटी ही है तो हम ड्यूटी भी चेंज नहीं करवा सकते। तो उसकी दिनचर्या हम ऐसे मतलब उसका आहार विहार हम ऐसे कैसे सेट करें कि उसको इतना तकलीफ ना हो?
Sir, Ahara Vihara se actually Ahara Vihara and it is related to this problem. It will there is no relation at all. So whatever Ahara Vihara you do and all the things, whether if there is a disc prolapse or there is a disc degeneration is there, so it is very difficult to revive it. Actually, I'm telling you one proverb. There is a proverb. Once there is a degeneration, the regeneration is very much difficult, particularly after the age of 50 or 60 years. If it is the patient is young and energetic, then definitely you can have some oral medicines and in the management. And if it is grade 1 antineuralisthesis also, you can manage in the OPD level. But if it is grade 2, then definitely it requires hospitalization.
ठीक है सर, समझ आया। अन्य कोई प्रश्न करता अपना माइक अनम्यूट कर सकते हैं। मैं हमारे आदरणीय उद्घाटक महोदय का भी आभार व्यक्त करता हूं, जिनके प्रेरणादायी मार्गदर्शन से कार्यक्रम को एक सशक्त दिशा मिली। साथ ही आरोग्य भारती पश्चिम महाराष्ट्र प्रांत एवं राष्ट्रीय स्वास्थ्य चिंतन आयोग का भी विशेष धन्यवाद तथा भगीरथी मेडिकल फाउंडेशन का भी सहयोग हेतु आभार। मैं सभी प्रतिभागियों का भी धन्यवाद करता हूं, जिनके सक्रिय सहभागी ने इस कार्यक्रम को सफल बनाया। अब हम शांति मंत्र से इस कार्यक्रम का समापन करेंगे। सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति। धन्यवाद सर।